Hello, everyone. Welcome to the Indonesia Social Science Seminar. And I hope to see more people coming in to our Zoom virtual space. But again, welcome to this exciting initiative. Basically, this is a global initiative. Uh, First of all, I would like to thank the organizers and, of course, our sponsors. Indonesia Social Science Seminar, or sometimes I call it IS4, is sponsored by the Sydney Southeast Asia Center, the Cornell Southeast Asia Program, and the Royal Netherlands Institute of Southeast Asian and Caribbean Studies. IS4 organized monthly virtual seminar series that brings together social science experts from across the globe to discuss pressing issues facing Indonesia. This series will foster new opportunities for networking between those working in Indonesia and around the globe. My name is Amelia Liwe. I earned my PhD in Southeast Asian History from University of Wisconsin-Madison. And currently I'm an assistant professor in international relations and also the head of the Master of International Relations Study Program at Universitas Pelita Harapan, Indonesia. Today's seminar is entitled the Non-Government Accountability Initiative in Indonesia's National Health Insurance. We have a speaker and also a discussion, very exciting, like one from Indonesia, basically located in Indonesia, and our discussion is in Hong Kong now. So let me just introduce you to our speaker. Our speaker is Dinna Prapto Raharja, also known as Dinna Wisnu. She earned her PhD in political science from Ohio State University. She is now an associate professor in international relations and a faculty member of Binus University in Indonesia. In 2016 to 2018, Dr. Dinna Raharja served as Indonesia representative to the ASEAN Human Rights Body. Currently, she is an expert member of the National Board for the Placement and Protection of Indonesian Overseas Workers. This is a kind of task force to combat syndicate of illegal sending of Indonesian migrants, overseas workers. She's also a senior advisor to the Foundation of International Human Rights Reporting Standards and also the founder of a consulting company called Synergy Policies. Dr. Dinna Raharja has published and has been awarded research grants extensively, and her research includes making national health insurance more responsive to citizens, funded by WHO, and many other publications. Maybe if you have time, you can chat with Dr. Raharja about her achievement and publication. Our discussion today is Dr. Diego Fosati. He is an assistant professor of Asian and International Studies and also an associate director of Southeast Asia Research Center at City University of Hong Kong. He earned his PhD in political science from Cornell University. Dr. Fossati studies political behavior, accountability, and representation, especially in the context of East and Southeast Asia. His work has been published in leading international peer-reviewed journals such as World Development, European Journal of Political Research, and Review of International Political Economy. Dr. Fossati has been awarded research grants by Hong Kong University's Grants Committee and Singapore's Ministry of Education. Again, if you have time, we can chat more about what Dr. Fossati has been doing. So today, Dr. Dinna Raharja will present her material for about 25 minutes. I will send a reminder through the chat box, and then followed by a discussion by Dr. Fossati for about 10 minutes, and then Q&A. So I encourage all the participants here, if you have any questions, you can type your questions in the Q&A box that is provided in this virtual space. And I guess that's all. I cannot wait, and I believe everyone here cannot wait for the discussion, for the presentation. So without further ado, let's welcome Dr. Dinna Prapto Raharja. The floor is yours, Dr. Raharja.
Thank you very much, Amelia. Good afternoon from Jakarta. Hope all is well and healthy. Thank you for the organizer, Indonesia Social Science Seminar Series, to invite me to speak here. I'm also saying hello to my discussant, Diego Fosati. I hope that what I share today will be useful and enlightening. Although I'm the principal investigator in this research that I'm about to share, I'm actually co-authoring this paper with Dr. Franciscus Joyo Adi Sumarta and Ratna Hanani, PhD candidate. We unite under Synergy Policies, Training and Research Institute. And the part shared here is a part of a project funded by the Alliance for Health Policy and System Research at the WHO Geneva. So this is a fresh from the open study. Actually, the process of completing the final reports and papers and all is still ongoing. So this is a sharing of one of the angles raised in the project. The study is conducted in 2019 through 2021 with ethical clearance and international standards of collecting data as usual. So let me start with the research focus. Kindly go to page 2. So this research is basically talking about government accountability initiatives, the logic of it on why and how it has been implemented in the context of Indonesian national health insurance that we call JKN. So the question is, how are the experiences of JKN members in availing JKN benefits? Can the JKN members navigate the system independently, supported by the government accountability initiatives, or do they need actually help from non-government initiatives? So if they need help, basically how the non-government initiatives do this work and why. So we actually see in this paper how the government and non-government initiatives interact. So if you know, the birth of JKN is in 2014. We basically see the entire process of what's going on in JKN until the end of 2020, plus some more in 2021. Because of the pandemic, we pushed back the end of the study. So basically, the finding can be mentioned as threefold. The limits of government accountability initiatives will be mentioned here, and I will describe why. And basically, the non-government initiatives, and then fill in and complement what has been missing, which is why the citizens of Indonesia often use their help. And so we try to identify what is actually missing and what are the functions that non-government initiatives do that the government has been failing to do so far. So we introduce the concept of oiling responsiveness of citizens through social accountability. So this is contribution to what past studies usually mention citizen participation in accountability, but very little has been said about how exactly this can be done, especially if the government is not quite welcoming to or providing formal mechanism by which citizens can actually improve the design and the implementation process of JKN. Next slide, please. So just the basics about government accountability initiatives. This is the central part of it because basically it's been understood that government accountability initiatives would help health system performance. And then it also provides legitimacy to public officials. And accountability is understood here as the obligation of individuals or agencies to provide information about and or justification for their actions to the other actors, along with the impositions of sanctions for failure to comply and or to engage in appropriate actions. So the question is, if you see accountability is being done, we would expect responsiveness to transpire. So how do you identify the signs of responsiveness? We took three items: responsiveness as a virtue, and then as mechanism and as a forum. So as a virtue, usually any design of national health insurance would not be perfect from the outset. So in that kind of circumstance, one would expect that accountability initiative that is virtue-based would help mend the missing gaps. So norms would help bridge responsiveness. As a mechanism, we would expect that agents can be held to account ex post facto by accountability forums. So there's a mechanism by which someone will be, by procedure, will be evaluated on what they have done in the system. And last, as a forum. As a forum, basically, we'll see contact and interaction so that people can ask, the public can ask for explanation, and then people can question the legitimacy of the action of policy actors. So at this stage of forum, we would expect that not only there will be questions, they may be judgment, they may be condemnation, and ultimately also sanctions. Next slide. So what we hope to contribute with a focus on non-government initiative is to explore how civic participation is done in a system that doesn't necessarily allow for one, but sort of invite inputs, which past studies would assume as critical to improve quality care and the equitability of the care. So in the finding, we see that our study is also helpful for the social accountability study, where non-government intervention in a national healthcare system may actually contribute to the improved universal health coverage in the sense of quality and equitable care. JKN system for availing benefits is basically done in a context as listed here. So there are literature review-wise, there has been this context. And in the bigger paper, I actually also cited Diego's work in there. So there has been initiative to reform national health insurance. The design of JKN had numerous compromises, political compromises included, and incomplete regulations. And there has been signs of navigators, but in the past studies, it's been understood more as a personalized kind of help. So very clientelistic in pattern. And last, role of labor union to monitor JKN has been identified. Next. So our data source are these. So we look into BPJS Kesehatan Care Center, BPJS Kesehatan Mobile JKN, and then BPJS 1, which is the officer placed in the hospital with minimum visit of 15,000 patients per month, and national government lapor.go.id, which is a web-based facilitating platform to connect government institutions so that people not only can ask questions, but they can also file complaints, grievances to the government's public service. So these are the government accountability initiatives that is expected to help citizens. On the other hand, we look at non-government initiatives that exist parallel to what the government is providing, which is BPJS Watch, Jamkes Watch, Posko JKN KIS, and in Manado, we also saw a different kind of assistantship, the Navigator groups, KSBSI and Suara Perempuan. Next slide. So this is the methodology. I'm not going too deep on this. We are taking 8 districts and cities in 4 provinces, covering Jakarta, Karawang, Bekasi, Mojokerto, and Manado. So the province is Jakarta, West Java, East Java, and North Sulawesi. Slide. These are the numbers of informants that we have covered and the time period that we have covered. Next. So basically, this is what the government can pay as JKN system. If you follow the system, you comply to this system, you basically will avail benefits, no problem. You need to just bring the JKN card and also the ID card, and that's all. You can go directly to emergency ward if you have medical emergency. That's all that is campaign. Next slide. So if you have problems with that, you can, number 1, call the care center 1-500-400. And this is what we find. Basically, the care center is not frequently used. The top province and the top cities being calling a lot to the care center, as you can see, is very much in Java, just slight bit on from Sumatra and Kalimantan. And the top 10 city is basically just around the megapolitan area. Next slide. And what's interesting is when we go in depth about what the care center officers face. So the list of the bullet points here are the things that they testified as something that they cannot solve, which is quite many actually. So as you can see, there are problems of regulations and interpretations by health facilities, which means that the system that we saw earlier and campaigned as simple enough for citizens to go through, to navigate, it's not necessarily the case. People don't understand the procedure. There's lack of specific explanation on how portability works from city to city. And you know, Indonesians, there are many migrant people as well, from Jakarta to elsewhere, or from outside of Jakarta to Jakarta, vice versa. So the poor also don't get information when they are dropped from the subsidized status. PBI is the subsidized status. So if there are any problems with administrative data, there's a time lag there. Employer violations, etc. Next slide. And then mobile JKN, same thing. Compared to the care center, mobile JKN is much more used by citizens. But as you can see here, the function of the mobile JKN is more to find information, to change address, health facility location, changing class, especially after shifts of the price of JKN contribution rate. Slide, next slide. And then this is also based on the interviews of patients and navigators. So mobile JKN as an application has been improved over the years, but still there are these 5 gaps. These 5 problems basically require JKN members to solve the problem directly to the relevant government agencies, and they are beyond BPJS Kesehatan. And at that time lag, BPJS Kesehatan basically cannot do much to help the citizens. They just wait. And of course, there's a chance the patients may not be able to avail benefits when they cannot finish the work with the other agency. Next slide. And then BPJS 1. BPJS 1 is known as, it was called somewhat differently in the previous era. So this is not totally brand new actually from BPJS Kesehatan. But what's different is now they are supposed to wear fast, yellow fast, and they are supposed to be mobile across the hospital and find people who need help. Their photos and pictures will be displayed. Next slide, please. And they would basically, next slide. You can see this is the little flyer that's displayed on 5 sites of the hospitals. That's the requirement, but it doesn't quite, as we do visits to hospitals across provinces, we don't quite see them as visible. And not all places put it in the places that's quite strategic for people to see. So if you go back, please, to the previous slide. So the problem with BPJS 1, even though it's very, could be potentially very helpful to citizens because they are on-site people to help patients. The problem is they also testified these 5 problems. And this is the testimony of the officers. And in the bigger report, we actually also tell more stories about how people try to engage with the BPJS 1, but because they are understaffed and they work on very limited working hours, that makes the assistance basically quite scarce, yeah, scarcely available for JKN members. Next slide. So now let's go to the non-government initiatives. Next slide. So these are the signs of navigators. We call it navigators, people who basically volunteer to assist JKN members. They do several functions, as I will mention a bit earlier. But as you can see, physically, they're not that obvious. So it's very much words of mouth. Some of the volunteers wear badge, but most of them don't. Only Posko JKN KIS from Bekasi actually wear the badge. Jamkes Watch has the badge, but the volunteers say they never quite use it. And in different places, as you can see from the outside, there's no visible signs of, navigator service or JKN assistance or nothing. Next slide. Let's go more detail about the similarity of navigators, their traits. So all of them, despite them coming from different groups, so they are mobilized and by different activists also, they have strong determination to guard JKN, to attend JKN, so that the poor, they say, the vulnerable, the uneducated people who do not gain benefit from JKN or are poorly treated as patients will be guaranteed to get the benefits. The second of all, they work on voluntary basis with no working hour, but technically they always receive phone calls 24/7, and they rely on mouth-to-mouth service, and they don't receive money, but instead they help each other's groups of volunteers. They have leadership figure, and usually this leadership figure has good personal relations with either the BPJS Kesehatan, the hospital officials, or staff. The norm there is that as much as possible, they have to follow JKN rules and procedures before taking alternative steps. And then in terms of response, they are basically responding to anybody, but so far they connect with general acquaintances, relatives, and poor people who live nearby their area. Next slide. So what I mentioned earlier, the rule of JKN is in that circle. So that's basically what the government see as JKN system. But what is being seen by patients and JKN members and navigators is the other thing, all this arrows and boxes. So it's a very complex process. You can fail at any box. So any box can also generate conflict. And if you fail to solve the conflict, then you would not get the JKN benefits. Next slide. So this is what we identify as oiling responsiveness. So the responsiveness from the government, even though they have accountability initiatives, we find it as not automatic. It has to be attended by somebody. And these navigators are serving these functions, providing information to citizens about the regulation, responsibilities, and rights. This is very critical because JKN is not only new to many people. The farther you are from Java, the more difficult it becomes to understand what the regulation means. Also, the regulations of JKN is because many is missing. along the way, there has been changes and addition to the JKN rules, which means function number 1 is very critical. Number 2, the function of assisting JKN member in navigating the JKN system. So understanding the information is one thing, and then going through it physically in the hospital is another thing. And when people is sick and have other vulnerabilities, they feel psychologically different, that they need help. Number 3 is policy advocacy. So this is more tied to the design of JKN and how it is implemented, either at national level or at the local levels. So the navigators basically try to help voice concerns and suggest ideas on how things could be made better for citizens. Fourth, this is interesting, they also enforce social sanctions, not only against the hospital, but also against local authorities within their network. So they do it either through media, or they demonstrate, or they, and in one case in Mojokerto, we actually find a hospital having to return the money that they ask from patients. So this non-government initiatives basically offer the virtue that was missing from the government. They demand accountability of behavior that shows responsiveness. And in a lot of cases that we saw, we see that there's negotiation between the navigator and the officers at the hospital or the local officials to say, come on, can you live or sleep seeing that this people cannot avail these benefits, with that kind of language. And then mechanism. So they put pressure on healthcare providers and report signs of poor performance or failure, either to BPJS Kesehatan in the capital or to the public. And then at the forum level, they have literally a forum. Some of the forums is virtual WhatsApp groups where they can actually humiliate, ask for responsibility and things like that. But other things is through seminars and public outlets. Next slide. So these what we argue as indicators of navigators' initiatives in oiling responsiveness. So they improve the compliance of health facility officers, and this helped minimize the possibility of JKN members' access being denied. And then they increase the knowledge of JKN participants. They also increase opportunities to include the poor. In some places, they actually negotiate for some poor to be included in the subsidized scheme of JKN. And then they also bridge local governments to provide subsidized health programs for citizens. So they campaign for it so that the local government also have allotted budget for that. And last, they improve communication between JKN authorities. They build groups, they also connect with each other, they tell each other what the other groups are thinking about the performance of the agency. Next slide. So this is the closing. Basically, what we think we contribute in our study is that in a context where the tendency has been very clientelistic and it's a very complex bureaucratic setting, one often fails to see the gap between design and implementation. And people tend to solve it on their own before passing it on to the higher ranks, which is why some of these government accountability initiatives miss in so many fronts. So they could have identified the challenges in the beginning, we thought, but apparently number one will become the challenge for them. Number two, digital divide. This BPJS Kesehatan continue to say that this is not their mandate to improve the digital connectivity, but of course, especially given the challenge of COVID, for instance, this become very critical for you to avail benefits. Third, low compliance of health providers. BPJS Kesehatan think that with the MOU of BPJS with the health providers, that will be sufficient. Well, the problem is there are problems of inaccurate data, absence of real-time solutions, unless someone actually talked to hospital authority. So this is a real problem. Fourth, some things are considered political. So day-to-day officers prefer not to meddle in. So hopefully by in this presentation, you can see that social accountability, they can help to alleviate some of the structural challenges. And this we call oiling the process of responsiveness. So not just participating, but you actually help make citizenship much more reality for people. Thank you. So far, that's from us. We would welcome your insights and input. Thank you very much.
Thank you, Dr. Raharja, for your wonderful presentation. Now I'd like to invite Dr. Fosati for a discussion. So the floor is yours.
Thank you, Amelia. Let me pull up the slides here. And I need to share the screen. And here we are. Thanks. Good afternoon, everybody. And I would also like to start by thanking Amelia and Dinna, but also the organizers, the University of Sydney, Cornell University, and the KITLV for this opportunity to share my thoughts about this very interesting presentation. What I would like to do in the next 10 minutes is, as I mentioned, to share some thoughts, some ideas that I got from these slides, but also to identify perhaps a couple of areas that might be worth discussing in our Q&A. So let me start. The first thing is that I appreciate in this talk is the very strong emphasis, the very strong focus on implementation and on trying to figure out what the gap is between policy design and implementation. Often we read research and opinions, pieces, or policy documents about policy in which the emphasis is on reform, on adopting certain policies, on identifying some policies that are especially progressive, especially useful and innovative, some best practices. We worry a lot about what drives these adoptions, what factors facilitate reform. Why do we see it in some places, not in others? But what we overlook, I think, often is that, especially in developing countries, in places that don't have much capacity in terms of institutional capacity, we always run the risk that these reforms remain reforms only in paper, only on paper. So it is very, very important to study implementation instead. And Dinna's work, I think, takes us exactly there. It shows like the surprising, perhaps not so surprising, complexity of implementation. A system, a bureaucracy so complex that even the Indonesian government itself feels compelled to come up with all sorts of initiatives to help citizens try to navigate this tremendous complexity. We learn about the myriad of actors that are involved, the interactions between government and society, the informal elements of it, the importance of social networks, words of mouth, volunteers, and so on and so forth. So a very good reminder, I think, that every time we study reform and we study moving towards more inclusive policies, we should have a clear focus on how such policies are implemented as opposed to just adopted. Related to this, again, implementation, I'm wondering a bit about the tension here between the national and the local level. Of course, the JKN is a national program, but it is being implemented in Indonesia, a country with a history of very, very high variation in how these policies are being implemented in specific locality. Regional spatial inequalities are very high. The map that you see here is from an article that I published a few years ago when I was doing research on the same issue. And it basically shows you coverage rates for Jamkesmas. You might know that this is the program that came before JKN. The main difference being this was a program aimed at low-income Indonesians. And the map shows you the variation, how different are districts in terms of their ability to implement, to cover these people. And as you can see, the variation is very big. You have like really a lot of variation. And I'm wondering if the JKN has changed that. To what extent has it? It's in many ways a more centralized policy, and I'm wondering if it still makes sense to analyze Indonesia as a heavily decentralized country, as we often do, or perhaps instead this program is contributing to make Indonesia a less decentralized place. Perhaps it is starting a push towards a re-centralization of sort. The third thing I would like to discuss is these ideas of responsiveness, accountabilities that emerge over and over again in Dinna's presentation and are very much the core of our thinking here. When we look at social policies, not only health policies, social policy in general, I think there is a tension, perhaps also a normative tension between focusing on policy outcomes and focusing on the process through which they are obtained. When we care a lot about policy outcomes, of course we want policies that work, policies outcomes that are supposed to be where they are. This is one way of understanding responsiveness, is when you, at the end of the policy process, you have policies that align with what citizens want, with public preferences. Now, if you care primarily about this, then the idea, the means that you can use to reach this kind of outcomes can vary. And perhaps, as Dinna has shows, these kind of oily mechanisms, they might be personalistic, they might be clientelistic, could even be the best option for many citizens. But at the same time, also, when we think about social policy, we also think about rights. We think about social rights. We think that everybody should be entitled to things like basic education, basic healthcare, food, shelter, and so on and so forth. And we know that these kind of outcomes, these kind of rights did not really emerge with this kind of clientelistic linkages. They emerge with advocacy, with public participation, with people fighting for these rights, with NGOs, with labor unions pushing for them. So we very much care about this process because we think, well, it's good for democratic legitimacy, but also provides better ways to provide for these rights in the long term. So we want a citizenry that is engaged, people who are aware of rights, who are paying attention to these sort of things, and they can have channels to exert this kind of rights, either legal channels or electoral channels, just voting politicians out of office when they don't perform. So I'm wondering, how do we reconcile these two things? The fact that we have reasons to believe this kind of like public participation advocacy is so important, but at the same time, perhaps in some context, we see that there are other modes of citizen-politician linkages that might also be good to keep politicians accountable in a way. Finally, I want to conclude with somewhat of also like a bigger question. And I am wondering specifically what the broader implications are of the implementation of this program, the JKN, for Indonesian democracy. As you know, if you're familiar with the literature on Indonesian politics, many scholars today argue that Indonesia is undergoing a process of democratic deterioration, of backsliding, especially when it comes to liberal rights. We worry about religious minorities a lot. We worry that the government is encroaching upon some civil liberties. But another way of looking at democracy is not only about liberalism, it's also about addressing some social inequalities. It does have this kind of social egalitarian dimension. And in this respect, Indonesia does not usually score well. A lot of scholars are thinking that, are describing Indonesia as an oligarchy. They're telling us that there are elites, predatory elites that dominate politics, and this picture basically has not really changed since democratization in the late 90s, early 2000s. We have these elites, they dominate, and people have little say, and there is just a very little chance of getting the policy outcomes that they want. So this is the narrative. It hasn't changed, but I am wondering if perhaps the reality has changed a little bit. Might it be that the implementation of JKN could be a change in a more desirable direction? JKN is a massive social program. It's one of the largest health insurance programs in the world. It's benefiting millions of Indonesia despite the various limitations that Dinna's research has highlighted. It is a big deal, absolutely. And it comes also in the background of a system that has been doing some progress, although gradual, in fighting poverty. Inequality has also decreased over the last 3 years or so. So might there be, despite the deterioration of the liberal elements of Indonesian democracies that many have identified, perhaps some progress, some positive developments on the more like social egalitarian front? Want to end with this positive note. End here. Thank you.
Thank you, Diego. Very insightful discussion, and I would like to invite everyone here to type your questions in the Q&A box. And I think we have one, and I wish to see more questions here. So you can type your questions in the Q&A box. Before I start to read the question, I actually have a question to both of you. So I'm interested to know more. Dinna, I think you must have explained it in your larger work of these issues. I'm interested to see like why you pick North Sulawesi as a case. Yeah, is a particular reason, because as Diego mentioned earlier, this phenomenon that you highlight probably has an implication to kind of larger political or social context in Indonesia. Considering North Sulawesi is a kind of oftentimes considered as a kind of marginal in Indonesian political context. So is there any particular reason why you pick the region as a case? And then the second one is along with that kind of reasoning, perhaps, if we place JKN, as Diego mentioned, this is a large initiative, a huge one, basically increase Indonesian bargaining position in the global arena. Yeah? This is a kind of showcase for Indonesia. So if we place JKN in the regional or global context, what kind of picture can we tell about Indonesian assertiveness in this initiative, and the fact that all these non-governmental accountability initiatives are being allowed, or I mean, the civil society seems to me like are free to express and to use the non-governmental mechanism, really create a good democratic picture of Indonesia in the global arena. So is there any kind of maybe intention in terms of, drawing a good picture of Indonesia using the JKN in the international arena? And, if you can share your opinion on this. And after this, I can start sharing questions from the participants. So again, I encourage everyone here to ask your questions by typing your questions in the Q&A box. But go ahead, maybe Dinna and Diego next.
Thank you very much. So Amelia, I answered the question from Diego and you first, right?
Yes.
Okay. Thank you, Diego, for the comments. All I think is very much appropriate and timely as well, given the focus of the study. So let me first answer the part on the dynamic between national and local levels. So I think from my study, I can see, instead of we concluding that the regional levels is not as important to see as a future focus, especially for JKN, I actually see more and more variations and resistance, if you may. There's a resistance not only at the hospital level. They interpret JKN rules and system very differently sometimes in different areas. And this is what may be interesting also to link with Amelia's question. Why? Because in outer islands, if you see the data from the few points of health facilities only, you will see that outside of Java, we have very uneven access, not only of health facilities, but also health workers. Now, we assume from the beginning that there would be difficulty to access JKN benefits, therefore, from the outer islands area, especially the further you are from the cities. However, we also find that that kind of argument is actually quite simplistic, because the viewpoint is solely on public health. And most of the studies in this field on JKN has been very heavy on the approach of public health, the approach of financial accountability, responsiveness in the sense of how efficient is the service that government is provided. So that kind of questions of how efficient things should be run and becomes irrelevant if you go outside of Java. Outside of Java, even inside of Java, the more you go out from Jakarta, what I mentioned earlier, the system of referral system, the national referral system, which is a tiered process. There are some governments who implement zonation. So the zonation means that number one, the poor cannot go beyond the zone of what is decided. If they want to get subsidized by the local government budget, they cannot go beyond the zone. So if they happen to be migrant workers, for instance, who work, let's say, to Jakarta, they cannot avail benefits in Jakarta using the money from the local government. How does that happen? Well, that's just the policy, and it's not regulated, so it's what it is. And then the other thing, there's also much micro level zonation. Like if you are from South Jakarta, the tiered level can be interpreted as, number one, you have to go through all the hospitals in South Jakarta before you go into, let's say, East Java or Central Jakarta, because some of the big hospitals are not necessarily in South Jakarta. Especially in the instance of ICU, for instance, ICU is very limited across areas. So if you happen to have very specific needs for ICU, or you are babies, like you need NICU, or pediatric, children, you need PICU. Oh, that's even more scarce. So if you need that kind of facility and you go beyond the zone, sometimes you'll be surprised. By the time you arrive at the hospital will deny you and say, oh, that's beyond your zone. And we don't know that until we experience it for ourselves. So there are so many variations that we find that I start to see that the national government may want to impose national standards and rules, but it may not necessarily work without very strong enforcement to the local levels, not only the public facilities, but also to the private sectors. Also has a different complexity in that. And then the question about rights. Oh, I agree. So one of the things that we can take from this research is the concept of citizenship. Actually, how then Indonesian government implement the concept of citizenship as rights. In the very beginning, one of the angle of the study was how we then can interpret citizenship in the country as fast as, as most developing countries also experience. Many citizens may not have proper identification cards. They may not register as citizens. They may not have the proper documentations to say that they are citizens. So what happened to the government when they try to surface the rights of health? So yeah, we can go and take from that angle as well. And then, yes, policy implementation level is, I think, very interesting here. I really hope that future study can then explore further how we can learn about the divergence, between design and implementation. And then about Indonesian democracy, whether it will be, it's interesting actually, the one who, and I also will link this to North Sulawesi question. The groups that I look as the non-government initiatives, as you know, this is not exhaustive. There are also groups that are based on religion, such as Nahdlatul Ulama and some of the Muhammadiyah groups also have assistance program for JKN members. But the extent of their assistantship to JKN members is different from this one. This one is very thorough because it comprises of 4 items. They actually helps patients navigate. They go with the patient to the hospital. Oftentimes they also speak on behalf of patients. So labor unions, there's not a paper that we are preparing actually from the angle of labor union, because labor unions in general has been very active in also fighting authoritarianism in Indonesia. And the fact that they are fragmented so much also show that there are tensions from inside on how they interpret power in democracy. And interestingly, if you look closer to my book in 2012, it also reappear again here that these groups of navigators, they also split as a group because they have history of togetherness to fight for this law of social security law. But then politically, because of 2014 election, they split ways because they have leadership figures and different orientation of politics. So, but at the individual levels, they work together just fine. So Posko JKN KIS, if you look at my research later on, once it's published, Posko JKN KIS actually comprise of members from KAJS, which is the core of BPJS Watch, members of Jamkes Watch, and also member of other unions. So Posko JKN KIS comprise of all unions inside. BPJS Watch has also elements of it. Perhaps the one that's more homogeneous is the Jamkes Watch. So it's a very interesting picture. North Sulawesi, however, is we went there, number one, because it's outside of Jakarta. We want outer islands perspective. And it's also the border areas. It's one of the frontier to Philippines. So we expect people won't have much options if they don't go with, they don't have JKN members, then what will happen to them? We are curious about that. In Jakarta or nearby areas in Java, people can still pay out of pocket and choose hospitals. But what happened if we are in North Sulawesi? That's one of the reasons. And then we find that there are several groups existing there, unions as well as non-unions. But because of their distance with Jakarta, they rely a lot on the interpretation of JKN rules from their colleagues that they make phone call with from Jakarta. And they are not quite confident in interpreting the law of JKN. They say because, well, we don't have direct contacts and day-to-day monitoring of what JKN do and happen. So when their patients need help, their colleagues and family members need help, they would call Jakarta and get the help from the Jakarta-based volunteers before they help their colleagues in North Sulawesi. So this is what I find interesting. The outer islands have less options. Yeah, they also have different kinds of navigation. Therefore, I guess what we can tell the world about JKN in the global arena, I guess because I'm a political scientist, I think that one cannot assume that a system that's been so deep under bureaucratic patrimonialism can just be freed from it automatically. You have to presume there are things to fix at oftentimes at macro level, and the assistance of people who are very persistent about democracy, about rights, becomes critical here. And the case of Navigators, the labor union activists that therefore build networks of experts, of community leaders, even seasonal workers, they also recruit as volunteers, become very interesting. Not only they become more and more aware about JKN, they also become more and more confident about engaging government officials, at least at the local levels. Not all confident with the national level, but with the local officials, they are more confident of engaging. Maybe that's for now, for that part.
Okay. Okay, thank you, Dinna. Wonderful. And we have many questions here, and unfortunately, we have very limited time. So let me just try to kind of summarize the question. So let's see if we can answer this quickly. So from Anissa, related to about whether the Kabupaten actually enroll everyone automatically, and how many of the recorded accounts belong to the people who are not aware that they are actually being enrolled, so they don't use the facility. Is there any information on that? And also, let me just combine the questions from Jerome and Ita about people with disability. What kind of GKN services for people with disability, and for the poor, how the poor pay for delivery services if they're not using JKN. I think this is more kind of straightforward questions. Maybe you can share if you have the information for that. And then if you can kind of map out, and the question from Jessica, the variation across, urban, the rural sites on that matter.
Okay. I cannot read that fast, but number one, the question from Jessica may be useful. This is still linked to what Diego asked earlier on democracy. I think if we see it from the spectacle of democracy, the variation is really interesting. On the political side, some of these areas that we focus on is also the area where some labor activists run as candidates, as legislators in the parliament. So in area where the awareness of labor as a movement and as a political pressure is higher, you will see different kinds of organizing. I'll take the example of Bekasi, where Posko JKN KIS is located. So their approach to the government there is, I would say, more accommodative, more friendly, if you can say. So instead of putting shame to the public, they would lobby and negotiate, and that's why they have two different groups of WhatsApp. One is for very practical, one among the navigators. The other one is with only among the top leader of the groups with the authorities, with the local authorities. So some of the, there are also some individuals from BPJS Pusat, the central of BPJS, who is included in that group. And the point there is to make sure that the bigger context is understood and all. But nevertheless, they are more accommodative. So in other parts, as I mentioned earlier, place like Mojokerto, for instance. Why I choose Mojokerto? Because Mojokerto is located not so far from Surabaya, but it's also rural. So how do you understand this? What's interesting about Mojokerto is that Mojokerto is not that far from Gresik and also from Surabaya, where it's a strong area for industry, or used to be. So labor unions does exist there, and they do try to be relevant to the context that where nowadays people cannot rely on wage alone for pressuring the government. Negotiating on minimum wage alone is has limits, but you can help your union members through JKN. And one thing I am surprised myself upon finding in this research is that we would think it's only the poor who suffer from being rejected by JKN. Salaried workers also have their own problems. So in future works, we can actually go in depth about it, because more and more there are violations from employers. Not only they choose to PHK itu apa namanya, laying off workers, termination of work. After termination, they not necessarily report that to BPJS Kesehatan. So the individual who by law would deserve 6 months extension of coverage after being terminated from work, lose that coverage immediately. So that instance, we now, on top of this, we are also exploring that angle. And then sustainability from Michelle. Also, BPJS account. Well, yeah, basically about BPJS account, about how many people are actually aware that this is the problem. And we discussed about our initial finding with BPJS Kesehatan. And by the way, you can see interaction between me and the governments again on the 10th of June when we present our paper officially this time. Initially we already have talks behind, but we also discuss about what their take has been on the status of citizenship, also the problem of administration of, especially about the poor. BPJS Kesehatan basically focus a lot on procedural accountability. So long as they already have the procedure to handle it and it's not their mandate, then it's not their issue. They have to comply and respect what the other agencies is doing, which at this point is the Dukcapil, the population agency at the national level, and for the poor coverage is the Ministry of Social Welfare. So we asked whether there will be different policy being implemented, therefore, so the poor can be informed about their coverage. They say, well, it's not us who handle this. This is the mandate of the other agency. So that perspective of bureaucratic response does exist, which I said earlier, sort of like make them cannot see, the gap of being responsive.
Okay, I'm sorry, Dinna. I think our time is out. Well, thank you very much for your wonderful presentation and discussion, Dinna. I wish you all the best for finalization of this project, and congratulations again. And thank you very much for our discussion, Diego Fosati. Wonderful insights.
Thank you.
And for all participants, everyone who have who's posted questions, I have recorded the questions so I can give it to our speaker and discussion. And hopefully, and I believe this is the purpose of the IS4. You know, we built a global network, so maybe you can contact Dinna or Diego and continue the discussion later outside today's seminar. Thank you again for the organizer, and thank you for the speaker and our discussion. And as a reminder, we have another seminar next month, and it's on competence and control, the effect of democratization on the civil service. Will be presented in June 24, 2021. And as you can see in the PPT, the speaker would be Jan Pescala, I'm sorry. And the discussion would be Professor Tom Pepinski from Cornell University. So I hope we can see all of you, most of you, in next month seminar. And thank you again for the speaker and the discussion. And I wish everyone all the best. Stay safe, stay well, and see you next month.